Thank you very much for your inquiry about a blepharoplasty. Blepharoplasty is the fancy name for essentially excising the extra skin on the upper eyelid and sometimes either removing skin or fat on the lower eyelid. It's a very safe procedure done by somebody that knows what they're doing. I do quite a large number of these. I always like to give you some oral sedation, and that means you have to have somebody pick you up and drive you. I always want you to eat before you come in. Essentially, what is involved with the upper lid blepharoplasty is I usually mark your natural crease, then I use some smooth forceps to determine how much extra skin you have, and I mark that. I then infiltrate the area with the numbing medicine. It's not very sensitive, and I go very slow and very gently. That will render the upper eyelid skin completely numb. I excise the skin muscle, and then most of the time all that's involved is one suture that starts by your nose, it weaves through the skin, comes out here. I put a little piece of a stair strip, which is like Scotch tape here and here, and you go home. The upper lid blepharoplasties literally just take 1 hour, almost no pain afterwards. I give you painkillers, but almost certainly you won't need it. I absolutely insist everybody take 2 days off of work and do lots and lots of icing and keeping their head elevated. This will do so much to help limit how much swelling you have. Many patients don't bruise, but I certainly cannot promise you. So you have to expect to get some bruising. If you get some bruising, it will last 2 or 3 weeks, but you can still return to work after 2 to 3 days, and you can of course wear sunglasses if you want. I usually will allow you to start exercising at about 10 days, but certainly before then you can walk around and go upstairs and things like that. The suture comes out usually 5 to 7 days later, and the office it just slides out. It's not uncomfortable at all. So it's a very easy post-operative course. Of course, it's very important your blood pressure be under good control. With regard to the lower lid blepharoplasties, these are a little more complicated, but essentially there's two concerns patients have. One is sometimes the bulging fat and sometimes the wrinkly skin. They're really two different problems even though they're in the same location. Most of the time for the fat that's herniating through, I'll do one of two things. Sometimes I'll just put filler in, because again, if you think of the face as mountains and valleys, it's not so much that the under eyelid is puffy, it's that you have a depression here. So by putting fillers in, you can think of it as filling in the valley. The mountain doesn't look so high if the valleys come up. So many patients do very nicely with something as simple as a bit of filler in the office. Some patients will have more prominent fat, where they'll just want it out, and the vast majority of times I'll make an incision on the inside of the eyelid so there's no scar, and the reason for that, it preserves the muscle of the lower eyelid, so you're less likely to get any problems with lower eyelid dysfunction. There's no sutures, and again, the recovery is very quick. Sometimes I'll address the skin. There's different ways of doing that. Sometimes I'll do a chemical peel. Sometimes I'll excise a little bit of the skin. So each person, I individualize it. I would encourage you to come in and talk to me if you have any interest in upper or lower blepharoplasty. It's important though that your blood pressure be well controlled, and it's always a good idea to see your eye doctor to just get your eyes checked. Even though I'm not operating in the eyes, I do operate in the upper and lower eyelids, so it's good to make sure that's up to date as well.